What if one vitamin could affect your bones, immune system, mood, muscles, heart, sleep, and even your risk of serious diseases? In this video, you will learn everything about vitamin D in the simplest way possible. No complicated medical language, no confusing explanations. You'll discover the real signs of vitamin D deficiency, the best foods rich in vitamin D, how much you actually need, when to take it, who is at highest risk, dangerous overdose symptoms, and the surprising health benefits scientists discovered. Most people have low vitamin D levels without even knowing it, and some symptoms may look normal until serious health problems appear. By the end of this video, you will understand vitamin D better than most people, all in one place, clearly explained and easy to follow. What is vitamin D? Vitamin D, cholecalciferol, is a fat-soluble vitamin that helps the body absorb calcium. Without it, bones cannot grow properly or stay strong. But vitamin D is much more than a bone vitamin. Scientists discovered that it also supports the immune system, the nervous system, digestion, blood formation, muscles and joints, heart health, mood and mental health. Some studies show that vitamin D may help reduce the risk of diabetes, heart disease, depression, autoimmune diseases, certain cancers. Researchers found that vitamin D works more like a hormone than a regular vitamin. It affects nearly 200 genes in the body, and according to studies, almost half of people may have vitamin D deficiency. Best foods. High in vitamin D. Vitamin D is not common in nature. The richest sources are fatty fish and a few animal products. Top foods rich in vitamin D. Cod liver oil, 1 tablespoon, 1,360 IU mushrooms. Maitake mushrooms, 1,124 IU. Chanterelle mushrooms, 212 IU. Morel mushrooms, 204 IU. Fish. Mackerel, 1,008 IU. Carp, 988 IU. Sockeye salmon, 668 IU. Pink salmon, 520 IU. Catfish, 500 IU. Herring, 216 IU. Other foods, red and black caviar, 484 IU. Egg yolk, 216 IU per 100 grams. Sardines, 192 IU. Pork fat, 124 IU. Seaweed, 96 IU. Beef liver, 52 IU. Goat milk, 52 IU. Fruits and vegetables with the most vitamin D. Important. Except for some mushrooms, fruits and vegetables naturally contain almost no vitamin D. How much vitamin D do you need daily? Recommended daily intake, 0 to 12 months, 400 IU 1 to 69 years, 600 IU 70 plus years, 800 IU pregnant and breastfeeding women, 600 IU maximum safe. Daily amount for most adults, 4,000 IU. Who needs more vitamin D? Some people need higher amounts because their body cannot produce or absorb enough. Higher risk groups include people living in northern regions with little sunlight, people who rarely go outside, night shift workers, people with darker skin, elderly people, overweight individuals, pregnant and breastfeeding women, people with digestive diseases, bedridden patients, people with diabetes, arthritis, hypertension, or cardiovascular disease. Types of vitamin D. There are several forms: D1, D2, D3, D4, D5, and D6, but the most important are D2 and D3. Vitamin D2, found mainly in plants and fungi. Vitamin D3, found in animal foods and produced in the skin from sunlight. This is the most active and effective form for humans. Why is vitamin D important? Vitamin D helps strengthen bones and teeth, improve calcium and phosphorus absorption, support the immune system, reduce fracture risk, maintain muscle function, support healthy cell growth. Medical uses of vitamin D. Doctors use vitamin D in many conditions: osteoporosis, rickets, bone softening, psoriasis, diabetes, autoimmune diseases, tuberculosis, respiratory infections, hypertension. Studies also suggest vitamin D may reduce colon cancer risk, breast cancer risk, cardiovascular disease risk. Some research even showed improved outcomes in multiple sclerosis, rheumatoid arthritis, chronic inflammation. Vitamin D and sports studies found that vitamin D may improve muscle strength, support recovery, increase testosterone levels in deficient men, but taking excessive amounts is dangerous and not considered safe performance enhancement. Vitamin D and weight loss. Research showed that people with enough vitamin D often lose weight more easily during low-calorie diets compared to people with deficiency. Vitamin D for hair and skin. Vitamin D is also used in cosmetic care. It may help strengthen hair roots, reduce hair loss, improve scalp health, reduce itching, and dandruff. Signs of vitamin D deficiency. Early signs are often ignored because they seem normal. Common symptoms: frequent infections, bone pain, back pain, depression, slow wound healing, hair loss, muscle pain, chronic fatigue. Long-term deficiency may increase risk of obesity, diabetes, hypertension, osteoporosis, Alzheimer's disease.
In children, severe deficiency can cause rickets. Why do people develop deficiency? Main causes: lack of sunlight, indoor lifestyle, sunscreen overuse, digestive disorders, liver and gallbladder problems, poor diet, obesity, aging. Who is most at risk? Babies who are only breastfed, elderly people, people with dark skin, people with inflammatory bowel disease, obese individuals, people after stomach surgery. Signs of too much vitamin D. Too much vitamin D can be dangerous. Possible overdose symptoms: nausea, weight loss, loss of appetite, excessive urination, irregular heartbeat, confusion, kidney problems, calcium buildup in blood vessels and organs. Very high doses over a long time may cause serious damage. How to check your vitamin D level. Doctors usually measure 25 OH vitamin D blood levels. General guideline: 3,100 Nung divided by ml equals normal. 20-30 Ning divided by ml equals insufficient. Below 20 Ng divided by ml equals deficiency. Blood tests are usually done in the morning on an empty stomach. How to take vitamin D correctly. Vitamin D is best taken in the morning with fatty foods for better absorption. Omega-3 fats may improve absorption. Vitamin D should not be taken together with vitamin E because they may interfere with each other. How long does it take to fix deficiency? Mild deficiency may improve after 3-4 months of daily supplementation. Severe deficiency may require higher doses prescribed by a doctor. Sunlight and vitamin D. The body can produce vitamin D from sunlight. People with lighter skin may produce enough in about 15 minutes of sun exposure. Darker skin usually needs more time. Important: you cannot get enough vitamin D through a regular window because UV rays do not pass through standard glass. Best nutrients for vitamin D absorption. Vitamin A helps absorption. Sources: liver, milk, cheese, carrots, mango. Magnesium is important for transporting vitamin D in the body. Sources: nuts, seeds, whole grains, spinach. Zinc helps move calcium into bones. Main source: meat. Possible risks and warnings: very high vitamin D doses may increase calcium buildup in the body and may worsen certain kidney stone risks in sensitive people. People with kidney disease, hyperparathyroidism, sarcoidosis, lymphoma should only use vitamin D under medical supervision. Important drug interactions. Some medications may reduce vitamin D absorption or effectiveness, including corticosteroids, antacids, cholesterol-lowering drugs, tuberculosis medications. Final message: vitamin D affects far more than bones. It influences immunity, muscles, mood, hormones, metabolism, and overall health. But both deficiency and overdose can be dangerous. The safest approach is check your blood level, follow the correct dosage, get regular sunlight, eat vitamin D-rich foods, and consult a healthcare professional before taking high doses. This video is for educational purposes only and should not replace medical advice.